Hey, everybody, we're back for your next episode of Mind and Scalpel, brought to you by the incredible Dr. Rothaus and Alexandra Janelli, both founders down at Modrn Sanctuary and Rothaus Plastic Surgery. We're excited today because I brought a special guest star with us that we're going to talk to and about. But what we're going to talk about today is some options for taking care of the double chin area, which a lot of people struggle with, whether you've put on weight, taken off weight. I know for me personally, I put on a bunch of weight having a baby. I've also had a bunch of weight put on from eating too much in the past and taking it off. But I want to first introduce our special guest, which is my double chin, Peggy. Peggy's here to find out what we can do about this. And Dr. Rothaus, there's no one better than to talk to you, because I know there are a million ways to do certain areas, and why not ask the experts? So I've heard about Kybella, I've heard about threading, I've heard about cool sculpting, cryoskin, thermi smooth. I'm sure there's a million other things I'm forgetting here, but let's talk about Peggy here.
So I want to get this clear. You have named your double chin?
Yes. From the Hamilton episode, you know how, I don't know if you've seen Hamilton yet or watched the movie, but they're
Yes.
like, and Peggy. Okay.
We'll have to discuss that off screen, but
A whole nother part
it's
of
a whole nother issue. Yeah, that may be mind and mind. Yeah. Anyway, so you mentioned a bunch of things. Let me talk about sort of like the big guys that people think about, especially when it comes to the chin, because you named a bunch of different techniques, and some of them are used really all over the body. But there's one you mentioned that's really sort of meant for the chin, was developed for the chin, and we get a lot of questions about, because it is owned by a very large cosmetic marketing giant, and that's Kybella. Okay, because I get a lot of questions about Kybella, and I know you had asked me about that in particular at one point as far as doing it. So when Kybella came out, we have it and got it in the office. My nurses were very, very eager to get it because they wanted to be able to perhaps do it themselves for patients. It was a procedure they could do, and we really didn't really use it very much. Most of our vials of Kybella ended up expiring on our shelves and getting thrown out. And the reason for that is that I did not find it better than what else, the other ways I had of treating that were in my, plastic surgery armamentarium. And obviously, if as a plastic surgeon, I come from a different perspective than, let's say, a dermatologist or an internist or an OB, perhaps, who was doing Kybella in their office, because I have other tools and other, tricks to use.
Sure.
So what is Kybella? So Kybella basically is a chemical agent that dissolves fat. Okay, and how it's done is the area is marked, and the vial of Kybella is drawn up. Sometimes you need one, sometimes you need two. Occasionally you might even need more. And using this grid, multiple needles are used to inject a little bit in each location. So then the fat gets dissolved, and what you're left with for the first week or 10 days is this swollen, red, painful, hard lump under your neck. And then that's the bad news. And the worst news is that usually it doesn't take care of the whole problem in one time, so you have to go through the whole thing again. And then after you've done that, patients do 2 or 3 times, with the average cost being about $1,800, because it's not inexpensive. You end up spending about between $3,600, $5,400 to $5,400 to have this done.
Wow.
The other sort of commonly discussed entity, which is owned by the same company, ironically, is the cool sculpting with the mini handpiece, and you can put that under your neck, and that has the same issues with that cool sculpting has in other areas. You could get it doesn't sort of blend well, so you could get areas of step off. It doesn't take care of it like Kybella. It doesn't all go away in one time. So you have to have multiple treatments. And I believe each session for that mini cool sculpting handpiece is about $1,000. So you're talking you're probably in the $3,000 range for that as well. So as you can tell, I'm not a big fan of that. So what do I do? Well, honestly, I think the easiest thing is just to do a quick liposuction under local anesthesia. I think it has a lot of advantages. I do it under local. I do it it's done through a little puncture wound that's sort of right behind your chin. It's in an area that nobody sees it. Most people actually have little scars there because they fell when they were kids and cut their chin under there or something.
I have
Yeah,
that on
yeah,
roller
you have that, right? See, I always look for it because I go right through that, and then do a quick liposuction. It takes 15 minutes under local anesthetic, and we get all the fat out. And the other thing you get, which I don't think you see with the other techniques, is you also get a little skin tightening because just the mechanical action of the cannula that we use against the undersurface of the skin induces some tightening. And then, both those modalities that I discussed previously, Kybella and the cool sculpting, they're limited to this area. The truth is, most of the patients, turn sideways in your chair, Alex. Okay, now turn the other way. Okay, so now you can look back at me, okay, if you want. So the one thing we can do is I can give you a little more local and extend it underneath the jawbone, the mandible, all the way back to here, and really get good tight sculpting of your jawbone like that, so it looks like that again. You can't really do that with cool sculpting or with Kybella. So that we can create that. If we decide to do that, it probably adds all of 3 minutes to the procedure, and it's done. And it's one time you walk out of the office. We send the patients out with a cool pack, a cold pack under their chin. We ask them just to sleep with their head elevated. There's no downtime. They're socially acceptable. When they walk out of the office, there's no stitch. They go to work the next day. Sometimes they could get a little yellow in their neck if they get a little bruise, but that's about it. So you don't have the redness, hardness that you see and sort of 7 to 10 days of discomfort as you see with Kybella. You don't have the need for multiple treatments as you see with all those other treatments. It is less expensive than Kybella and
wow,
cool sculpting. It's very quick, it's very easy, and so I personally can't see a reason to do any of those others for that area. I think the easiest thing is to use liposuction. Now, if the patient is a little older than you and they have lots of skin laxity, we can combine that with a little laser device or a radio frequency device. We use Smart Lipo. They have a smaller fiber they call their Precision TX fiber, and it's meant for the neck and the chin. And we can add that before we do the suctioning and basically get more skin tightening if we need more.
How interesting. It's so funny because I don't think in my mind, I'm being 39, I don't think I would have ever considered liposuction or smart lipo on the face. I think of it so much around, the midsection or thighs, etc. And I think when you first said liposuction, my mind immediately was like, oh my God, that's so dramatic. It's so drastic. But as you describe it, it seems a lot less drastic than having a million needles stuck in your face over and over again. I think there maybe in my mind, when we go into the subconscious associations, right? In the mind part of this, I have such an interesting association built in of what I think liposuction looks like. And maybe this is like an old 1990s prior thing, but as you describe it, it doesn't sound nearly as frightening or scary.
It's not. It's really not. First of all, for the neck, the instruments we use are so thin and they're so small that there's really not. I mean, they're really not scary to look at. And the one thing I don't want to forget is when I start to talk about smart lipo and precision, is the other modality that's really used these days is radio frequency. In
Hmm.
our office, the device is called Thermi, and some people are using a plasma device as well. So there are several energies that you can use. In our office, we have a choice of laser and radio frequency. I tend to use a laser more only because it's a little faster for the patient, so they're on the table a very short time. Anyway, but yeah, it makes no sense. So why do people do Kybella? Well, honestly, not every physician is a plastic surgeon and has the capability in his office to easily, under local anesthesia, do a quick liposuction. Okay, so that's part of it. So there's that old expression: if you have a hammer, the whole world's a nail. So if the only tool in their toolbox is Kybella, they're going to use Kybella, and I think that's really what it comes down to. Fortunately, at Modrn Sanctuary and Rothaus Plastic Surgery, we have lots of hammers and screwdrivers and wrenches and everything else in our toolbox. So we have a lot. I mean, we have a lot of modalities to treat the patients. So it makes no difference to me which tool I use, as long as the patient gets the best result. With the least downtime in the most cost efficient way for the patient. And I think it's liposuction.
My other question about liposuction that a friend of mine had brought up was, and maybe it's not the same for the face, but there are times when there can be an unevenness just because I guess when you're sucking fat out, how precise can you get? Is it more precise the smaller instrument you use?
So I really, there should not really be irregularities in liposuction at this day and time. I mean, it can happen, but that's really rare. The irregularities are more likely to occur with cool sculpting or with Kybella
Right.
than with
Okay.
liposuction. Part of the reason is the liposuction in the 80s and 90s. You did see a lot of that. First of all,
Well,
people,
Nicole Kidman, wasn't it Nicole Kidman with her nose?
she had liposuction on her nose.
Oh, who was talking to me about it? They were saying it was something about like there was a whole just like a shift in her face. Maybe it wasn't Nicole Kidman.
I, I,
I'm not. I'm
I don't know. I
sorry.
don't. I don't. I don't.
You're
I don't know.
gorgeous.
But I've done hundreds and thousands of liposuctions. I've never done a nose. So okay. But anyway, yeah, I've injected fat in a nose, but I haven't taken it out.
Interesting.
Anyway,
Talk about
okay.
that next.
Okay. So basically, the liposuction in the 80s and 90s were using instruments that, compared to today's instruments, were really, really crude. Okay. And they were not specifically designed to do liposuction. They were borrowed from other specialties in medicine. They were large. And on top of that, people were just getting trained. And I don't think they had the experience. And everybody was jumping on the liposuction bandwagon.
Right.
You shouldn't see that today. Anybody can get an irregularity. I mean, that is part of the risk of it, but the incidence of that is really, really small.
And the machine that you're using, so it's just a tiny little.
It's called a cannula. Okay. It's called a cannula, and it looks like a little metal tube. It's a really small metal tube. Under the chin, when we do it, the two cannulas on our tray, we have a tray just for that, are 1.8 millimeters in diameter and 2.4 millimeters in diameter. I do it through a puncture wound. I don't use a scalpel. Just to let you know how small it is, I just make a puncture wound with a needle, and these pass through that. There's no need for a stitch afterwards. I mean, we
Oh,
put we put a spot band-aid, a little bacitracin and a spot band-aid over the spot where it went in. That's it.
liposuction you could leave with just a little band-aid and some
A
Vaseline.
little. I haven't used a suture in a liposuction case for maybe a decade.
That's
We
amazing.
just, yeah.
See, my brain, my mind, has holding on to this whole other vision of what liposuction is.
No, I will tell you, during liposuction, there is no scalpel.
I-
Whatever.
Yeah, totally. Backwards when we look at it on our side.
Oh yeah, I know. Oh, did I do it wrong? Okay, sorry.
All right.
It's this way scalpel, right? That
Yeah,
scalpel hat?
right.
Scalpel.
Exactly.
Okay, got it. Got it.
I think that's really exciting information. And again, like to each their own, there's benefits to going to see a plastic surgeon who's going to have more tools in their tool belt, it sounds like, than your nurse practitioner or whomever else might be doing your injections, dermatologists, etc. So we look forward to answering any other questions you might have about treating this area. Can you do other areas on the face? I mean, I guess you wouldn't really need
So,
other areas other
I
than here.
mean, well, so when we do liposuction the neck with like the laser or that we will actually pass the laser fiber above the mandible. I don't suction there, but I bring the fiber there. It melts the fat a little, but it also tightens the skin. So a lot of boomers and later Gen X and are coming to the
Right.
office, and we would use that to get skin tightening along the mandible, the marionette area with the laser.
Oh,
And then in those patients, we make a second and third puncture wound behind the ear, and we come way down on the neck. We treat the whole neck with it.
and that's still under local.
It's all under local. I do all my liposuction local. I do full body liposuctions all under local. We haven't sedated a patient for, I can't remember the last time patient with liposuction got sedation. They come in the office, they have the liposuction, and they walk out of the office.
Wow, that's incredible. Do you know? Of course, you know. It's a silly question. Um,
Yeah, really.
is there a difference? I know you've mentioned liposuction versus smart lipo. Are they different, or is it the
Uh,
same?
Yeah, they're different because liposuction is a general term. So traditional liposuction just uses the cannula and a suctioning device, a machine to
Yeah.
take the fat out. Okay. With smart lipo is a type of laser lipolysis. So it's not suction assisted lipolysis, it's laser assisted lipolysis, which means you initially laser the fat and then you suction the fat out. The advantage of that is it melts the fat, okay, and it breaks up some of the scar tissue, so you can use smaller cannulas. So you could go through a puncture wound and there's less trauma, so there's less bruising. So it has certain advantages.
Oh, that's so interesting to know.
And you get more skin tightening as well.
More. I like that idea because I think for a lot of people, I would imagine, depending on how much fat you're sucking out,
Yeah.
then you have the skin issue.
Yeah, my guess is, Alex, that you would tighten just with conventional liposuction. You would not need laser lipolysis because you're young enough that you would get tightening.
And the other thing, I guess, what you were saying in terms of threads, which are becoming very popular, that's not going to get rid of the fat, right?
Threads will not.
That's just
Threads will.
a pull.
Right. Threads are just a pull.
Very cool. Well, I guess my only other question is, can I take my fat home with me? Or can we inject it in other parts of my body?
We really won't get that much fat out to inject, but I mean, we do take a lot of fat for injection elsewhere. The fat, if we took it with a laser, we couldn't. If we took it with a conventional cannula, we could. The amount of fat that you probably get from under your chin would not go a whole long way.
People use injections of fat for, like, can you put them in your lips? Like,
Oh, you can put them in. You
I
can put them. You can put them anywhere you inject a filler. Anywhere you inject a filler, you can put it. And we use it both. I mean, common areas are certainly facial injections along the tear trough and the lips, nasolabial fold to build. If someone had a weak chin, we can use it to build up their mandible and their chin. We can put it for cheekbones. A lot of most people as they get older, they get a little temporal hollowing. You can
Yep.
see it comes in there. It's a very common place to put it in. You can do really sort of, women seem to get it more than men, and you can really do a lot of rejuvenation by putting some fat in that area. And of course, a lot of people are using it in conjunction with implants or even without implants for breast augmentation.
Interesting, cool. Is it better than a filler? I know a lot of people will use filler in their tear troughs, etc. Is there a benefit to using your own fat versus a more synthetic alternative?
I mean, well,
Does
so
it?
I don't see the hyaluronics as synthetic. I mean, most of the fillers I use
Right.
are hyaluronics. Yes, they're lab manufactured, so I guess they're synthetic in that sense, but they're a natural molecule. But having said that, what are the advantages of them over fat? Uh, we're going to get into a whole nother
Yeah.
session here. Is that what you want to do? Would you?
It tastes, and then
You
we'll
want you want
check
it?
one way or
Okay,
the other.
okay. I think the advantage of the fat, and we can get into it in another time, is that it is your own body cells, and that if it all takes, and about 2/3 should take, it's there forever. There are disadvantages as well, and there are advantages to fillers. But that would be a good, if we talked about fillers, fat, and threads, that might be, if people are interested, that would be a
3 F's of plastic surgery.
yeah,
Filler.
fat and
Oh, well,
threads. It's a T.
it's not
Unlike Freds.
It's with an F always.
We'll call it Freds.
We'll call it
Anyway,
Amazing. All right. Well, I look forward to talking more about this with you in a consult. And of course, like if I do decide to do it, everyone, I'm going to post my before and afters because the work I'm
maybe we'll post a video of me doing it on you. How's that?
Yeah, you can
Okay.
just like enjoying every moment while I'm listening to a meditation,
Right.
a face mask, a crystal face mask on, getting my nails done.
Probably can't keep the crystal face mask on while I'm
We'll do it
doing
after.
my procedure. Yeah. But we can do the meditation part.
Perfect.
Okay.
Great. Amazing. Well, thank you, Dr. Rothaus, again
Thank you, Alex.
for your knowledge, and we'll talk soon.